As if thinking Americans can get the coronavirus just by walking outside wasn't bad enough. Well, the liberal media are now trying to spark panic over the president's health.
Why not get tested yourself after you interact with Matt Gaetz and Doug Collins last week?
Well, I don't think it's a big deal. I would do it. I spoke to the White House doctor, terrific guy, talented guy. He said he sees no reason to do it. There's no symptoms, no anything.
No symptoms. President has nothing. Well, that's not good enough for the experts at CNN.
When I hear so many Americans want these tests, right? I mean, there is a dearth of testing, and that is the big problem. But when they hear the President of the United States saying, I don't think it's a big deal, is that the right message?
Oh, wait, you mean the message that the president is healthy? I think that's what Americans want to hear, right? And it's what the real experts are telling him to say.
I will say, Brooke, that actually just moments ago I got off the phone with an infectious disease expert, and she said that at her hospital, even if you've been possibly exposed, even if you just got off a plane from Italy, if you don't have symptoms, they don't want to test you, even if you might have been exposed, as perhaps the president was. So what he's saying actually jives with what doctors are telling me.
That's the old thing, like when you're in a courtroom. Never ask a witness a question you don't know the answer to. So she's like, okay, let's move on quickly. Now, remember, Trump, though, they say is the real science denier. But wait, CNN gave this narrative one last shot.
Let me just get your thoughts. Should he get tested?
I agree with the president. If he has no symptoms, there's no reason to test him. Without symptoms, I don't think people need to be tested. And if the White House doctor says you're fine, you don't have any symptoms, you don't need to be tested, I agree with the White House doctor.
Oh, let's go for a third time. Joining me now is the doctor you just heard, aforementioned Carlos del Rio, professor of medicine at the great Emory University. Also with me is Dr. Marc Siegel, Fox News medical correspondent. Great to see both of you tonight. Dr. del Rio, what's your message to those who are pushing this narrative that it's irresponsible of the leader of the free world in the midst of this crisis not to himself rush out to be tested? I mean, they're all day long, you've been hearing this in the American media.
Well, whether you happen to be the president of the United States or not, if you don't have symptoms and there's no indication from a medical physician that you need to be tested, you should not be tested. And we know this from several tests, and this is no different than other tests. If you test people that have a low likelihood of having a disease, then the probability that a positive test will be a false positive increases significantly. So we don't like to test people that have a low likelihood of a disease. And in the case of the president, he had not a direct exposure, not a direct contact. He has no symptoms. There's really no reason to test him.
Yeah, and Dr. Siegel, we've seen this with this CPAC attendee who tested positive after the conference for the coronavirus, and he shook hands, and then they shook hands, and then Matt Schlapp, the head of the CPAC, came on this show, and I shook his hand, and I hugged his wife. So like, I guess by this logic, I should be tested for the coronavirus, and my throat has nothing to do with the coronavirus. It's laryngitis.
By the way, you forgot that I was in Nebraska meeting with the nurses and doctors who took care of actual coronavirus patients.
Right.
And I didn't get tested.
So, again, it's a multi-level irresponsibility on the part of all of us, I guess. But this just leads a lot of people to go into deep panic, Dr. Siegel. And at this point in time, I think we've cornered the market on panic. We need calm and preparedness.
Yeah, for sure. I mean, we have concern about this virus, but we keep jumping to the worst case scenario and envisioning the worst, and that spreads panic. That's what's destabilizing the markets. That's what's getting everybody sequestered in their homes. In this particular case, the president actually showed the right example. I have met the White House physician. He's a very sober guy. He gave his judgment. So first lesson here, listen to your doctor. Doctor said don't get tested, right? Second lesson here is he didn't have direct contact with someone with coronavirus. He had contact with someone who shook the hand or had a photo op with someone who had coronavirus. So how many times removed is that? If he had gotten tested, Laura, he would have been sending a message to the United States. If you're walking down the street and you hear that someone in that hospital has coronavirus, get tested, we would have a surge of people that were convinced they had it. So actually, he projected calm in this situation.
Now, Dr. Del Rio, Rio, tonight, this is a big election night for the Democrats, okay? So Biden sweeps to victory in all these races, all these primary races. Both candidates have canceled their big events. Biden is addressing only his close supporters in Pennsylvania tonight. But Bernie Sanders is not only not speaking to thousands like he had planned to do, he's not appearing in public, apparently out of concern for the coronavirus. Does this make sense absent some presence in one of the hot zones or containment zones, such as New Rochelle or maybe in Washington State?
Well, part of the problem we have, Laura, is that unfortunately, as you know, there was a mishap in the testing, and we are way behind testing in this country. And as we ramp up testing in the country, we're probably going to find a lot of people who are infected who we don't know about. And at this point in time, until we have further data, we need to assume that there's a lot more communities that we are aware of that have community transmission of the virus. And when there's community transmission, one of the most effective strategies to control the transmission of a virus like this one is what we call social distancing. So it is prudent to establish social distancing. I think it's appropriate that in many of our communities we try not to bring a lot of people together until we have better data. Once we have better data, I think we can make better decisions.
All right, we had, go ahead, Dr.
Well, I
Siegel.
agree with Dr. Del Rio about his principles here and the medicine of this. I would not come to the same conclusion because that's the paranoia again. We're going to assume every single arena we have has coronavirus in it. I mean, there's just not, we don't have the sense that there's that much coronavirus here yet. There's definitely more than we know about. He's right about that. But we don't need this fear of going outdoors. It's agoraphobia. They have a diagnosis for that. Let's get the testing done and then we can decide. Not just avoid everything in the meantime. I went to the Knicks game last week, by the way. There was no one there. Now, the Knicks are terrible. That might be the reason.
Well, the NCAA men's basketball tournament, we all have our pool. Oh, wait, we're not supposed to have a pool here. We have a fake pool here at Fox, so we want this tournament to go on, but we don't want anyone to be endangered. They've already canceled the half marathon in New York, Dr. Del Rio. They're canceling conferences. It is doing huge harm to the travel and entertainment industry, and I think that in and of itself is sending people into some panic, so they're going to buy water, they're fighting over toilet paper. I mean, that can't be good either. Look, you can get infected by fighting over toilet paper, I guess. You take it to its extreme.
Well, in fact, I agree with you. I think we don't need to spread panic. And I was talking to somebody today, and I was saying, you know, the biggest risk you have maybe of going to a big arena today or having, you know, go to a tournament may be, you know, drinking too much beer and falling and hitting your head. And not for that reason, we're not canceling those tournaments. So I would say, again, we need better information, we need more data, and we need to sit down and really look at the data carefully. But I couldn't agree with you and with the doctor anymore that we need to you know, we need people who be prepared, but at the same time, we don't need to spread panic.
Yeah, and we got the testing finally set, which is a good thing. So millions of tests will be produced in the coming days and weeks. Gentlemen, great to have both of you on. Extremely reassuring and informative. Thanks so much.